you were, which is the counter of everything we think of as being possible in our country, which is my kids will do better than I do. So you are going to undo all the good policy that you're doing to create wealth and to combat poverty if you don't address this issue. And there's a lot of attention, rightfully so, on early childcare education, on early life. We need to have just as much priority on the rest of life and, end of life, everything in between those two things. And so the reason I really focus on that with legislators is because, they're inundated with crises constantly. You really get a 5-second elevator pitch to make the case why this should be elevated above homelessness, wildfires, criminal justice reform. All of these are, crises that are occurring. They're all extremely important. They're all extremely righteous issues, but we have to cut very quickly to, this is why you need to pay attention. Because if you care about poverty, which everybody in the legislature and in the governor's office says they do, then you have to care about this. And so framing it from that lens, to me, takes it outside of this wonky, let's get into the details of what Medicaid covers versus what Medicare covers, which then the eye rolls and you start falling asleep, into this is why it's so pressing that we pursue what we're trying to pursue here, which is what works in our system, or what works relatively. We know Social Security is a model that people love. It should be way more money, but the model, right? We know Medicare is a model that people love because it is something they contribute into and they have something to look forward to. Can we use those models and just incorporate long-term care? Because, it just didn't exist 100 years ago when these programs were first created. How do we recreate successful models that do not draw upon the general fund? Because that is the other thing that catches everybody's attention in the Capitol. How much is this going to cost? Cut to the chase. How much money do you need? Literally, if you know anything about lobbying in the Capitol, how much does it cost is the number one question. So we want to get away from this is how much it's going to cost this state to how do we become sustainable and independently funded so that it becomes its own successful program and takes it to the next generation, Social Security 2.0, Medicare 2.0. How do we incorporate LTSS for a wide spectrum across ages so that then becomes another successful model? And, I use the term social insurance. Basically what it means is risk is spread across the population. Funding is spread across the population. If you know anything about private long-term care insurance, you know that it is too expensive. Why? Because people self-select. So the people who are purchasing policies are likely to be people who actually need them. And from a purely cost actuarial perspective, that is not a profitable model. I think there's maybe one company left in the state that even offers a policy on long-term care. Why is that? Because it's not spread across the population. So what we need to do is approach this from a social insurance perspective that spreads risk across the population, that spreads cost across the population. And I'll be clear too, from our perspective being UDW, I am not fully convinced that there shouldn't be other revenue sources that we draw upon to fund this. Again, looking at it from a perspective of economic inequality. So, the funding piece is going to be the real big kicker here that we haven't quite figured out. But the point is taking this out of the realm of individual people and families, basically dog eat dog, trying to figure out how to do this, into a social model where society incorporates this as a part of what it means to have a good society. So I'll pass it along again to my friend, Christina.
Thanks, Christina. I think that one of the things that's really important for all of us to think about is that while Christina is talking about making sure that this service is available for people across the age span in California, it's real easy, quite honestly, in legislative meetings, in any type of policy environment, to talk about it from an aging perspective. And the reason why is because California and the federal government have done a great job collecting data on folks who are aging. When it comes to disability, there is not a lot of positive data. There is data around poverty. There is data around the continuous cycles of help and need that people with disabilities um, are perceived to have in order to survive. We really need to get grounded in a very, very different fundamental conversation. So when Christina said that a lot of people see disability, well, she didn't say it specifically, but I interpreted it as we still live in a society where disability is seen as pity and poverty. That's what it is as a whole. And part of the reason why I truly believe that that continues to perpetuate is because we have a low number of people who identify as disabled. It's still not okay to say you're disabled or that you're disabled and proud, like many of us in IL and in the disability community in different generations say. People who are aging, my grandmother, who has every service under the sun, definitely does not want to identify as disabled. We need to fundamentally change the way disability is talked about and seen. Just like you grow older, and while lots of people are not thrilled to consider themselves a senior or an older adult, it's acceptable. And to be disabled is still not acceptable. And so when these systems and these programs were set up back way before my time, the social justice, the pity model, the charity model, the medical model of disability all continued to stay the same instead of change with the times. So when we say, you know, the reason why 75, 72% of people with disabilities are still unemployed, well, there's a reason for that. We have set ourselves up in a system that believes that we can't be employed. I went to a conference last year, a very popular conference that I'm sure many of you were at. And what the entry video of the conference included, while I was very excited to see people with disabilities and older adults a part of it, the woman with the disability featured in it talked about how she can't work because she's on SSI. That's the messaging we're sending to people with disabilities and young people. We cannot continue to send that messaging. If we ever want to change the way these systems are created, we have to empower individual people. That's where we need to start the fundamental change of equality. And I just want to point out that while we might have long-term services and support insurance models that we can pay into, for those of us that have pre-existing conditions, we don't have that option. So it's either Medicaid or nothing right now. Why can't we create something where we have some sort of choice? At this point, there is no choice. Either I become a millionaire and somehow am able to pay for my family's LTSS needs throughout our life, because for those of you who know me, you know my entire family is disabled. Or eventually, and while we're good savers, I would say, we're still in a place where we're on the cliff. If anything were to happen to us, we're going to be stuck going back to Medicaid. It shouldn't be that way. We need a system that covers all of us and gives all of us choice and doesn't put us into a poverty cycle that is dependent on the government. So really, that's what we're working towards doing. And I think if you haven't read the Milliman study that the state just recently published and has had a couple of meetings on, I would encourage you to read past the executive summary. And I'm willing to admit that at first I only read the executive summary and I was a little freaked out because it didn't necessarily come out and say it wanted to include people with disabilities in it. But if you read beyond that, you can see that there are opportunities to change the way the system is set up in California right now. And we should be the leaders of this conversation. And while there's other states that have created LTSS benefits, they haven't gone as far as I think California is going to go, and what we're fighting to do in order to make sure that people are equally covered under an LTSS benefit in California.
That's a great transition, Christina. So folks may or may not know, there's 2 states that have actually passed some version of what, you know, social insurance benefit. Washington State passed last year or possibly the year before, the first of its kind model. It is based on a portion, a very small percentage increase in the payroll tax. And it funds a fairly modest benefit with a time limit. I want to say 2-year time limit that you can actually access the benefit. It was first of its kind. It's not wildly generous. It's, I would say, a very conservative program, but it's still the first. So kudos to the folks in Washington State. Hawaii has something called the Kapuna Care Program, which my understanding is Kapuna means caregiver or elder in Hawaiian. I'm not sure. It's based on a percentage of the state tourism tax, and it is a benefit that is paid to the caregiver to help family caregivers offset caregiving costs. So that's another model. And those of us who are members of CADA, we actually spent a good 1.5 years talking with experts from all over the country. We talked with people in Hawaii, we talked with people in Washington. We literally talked to anybody who would talk with us about what these models could look like. And we started from the perspective of everything's on the table. And then we started to filter. Okay, we're taking that off, that we can all see doesn't make any sense. There was a real purposeful goal there for me, which was everybody getting to the same place at the same time, so that nobody in our coalition felt like there was an ulterior motive, that there was a hidden agenda, that we were kind of, you know, coming at it from different perspectives and trying to win each other over to each other's, you know, interests. We all got there together by this very expansive review, you know, I would say literature review, expert review. Then we kind of got to, okay, well, we see what we think will work is some sort of managed cash benefit. We did a couple of things, which is one of the reasons why this coalition is one of the best I've ever participated on. And honestly, when all is said and done, I will hold up our work as being at the forefront nationally. When we first got together as a coalition, we knew we had a lot of review and a lot of discussion. We didn't want to not do something in the legislature because we wanted to use the legislative process to build on our campaign. So in 2018, we actually advocated for $3 million in funding in the budget to ask questions on LTSS need. As Christina said, we don't have a lot of data, especially on people with disabilities. So we said, well, what can we do? Let's get some more data. So we won $3 million in 2018 to ask for 2 survey cycles for the California Health Interview Survey, which is a nationally renowned health survey among Californians. So for 2 survey cycles, they are going to ask questions relative to LTSS need. And I'm happy to say, and that survey is conducted by UCLA. We actually brought the woman who is the research director up to the Capitol to meet with lawmakers to talk about what the survey does and how it could be supplemented. And I'm happy to report that according to the research director, there is some preliminary data that they can begin to share with us. I want to say November. We just have to schedule something so we can do a briefing on what they're starting to learn. So the data is starting to come in. So we're seeing, like, we planted these seeds. We're starting to see some, you know, blossoming of our trees here. 2 years ago, last year, we said, okay, well, we need an actuarial study because that's what they did in Washington. That's what other states are doing, so that we know how much this would even cost. So we got $1 million in the state budget last year to fund Milliman, which is an actuarial firm, to do, and you know, again, talked with Milliman, brought them to the Capitol or connected them to lawmakers, connected them to the members of the administration to say, this is what an actuarial study does. We don't have this data. We actually had some members of the administration insisting to us that they knew all of this, which we knew was not true. So that was last year. They conducted a wholesale analysis of costs and potential costs. And so we got the actuarial report about 6 weeks ago, and I put the link for that in there in the chat box. As Christina said, we highly encourage folks read it, although it is pretty technical. So that's another like seed that is now starting to blossom, right? And so now as a coalition, we're saying to ourselves, what are we ready for? What's the next step? Sadly, pandemic changed everything. COVID changed everything. Where we would be now versus where we are if COVID never happened is a whole very terrible,
different story.
whole different, and we all know this because this impacted everybody in every way. My goal would have been that we would have introduced a bill in January to actually create this system. I don't know that we're quite there yet. I would say we're in the examining of revenue sources phase of this. We're still educating lawmakers. We did introduce a bill, SB 512. It was authored by Dr. Richard Pan, who is also the chair of Senate Sub 3, which is the budget subcommittee that we were able to get the funding from. Dr. Pan and Assemblymember Kalra. So we did have a legislative vehicle that frankly created kind of like almost just a framework without getting into the content because we weren't ready for content. So SB 512 sailed through the legislature. It was a great tool for us to talk about why California needs to create a universal LTSS, but frankly, it didn't talk about money. So I suspect we'll have a way different outcome when we do that. The bill did die because we didn't expect that it was going to get signed. And so it died in the second year of the session. But we're in the process now of talking about, what do we do legislatively next year? I'll be honest, the fact that we're in this economic downturn is just really complicating matters because we're getting a lot of, don't think about taxes. No one think about revenue, don't do anything because everybody, we're in this economic downturn. I espouse a different perspective. And again, speaking simply for our organization, my feeling is there's a lot of people who are making a lot of money right now, specifically from the pandemic. There is a lot of folks who actually aren't paying their taxes at the same rate that working and middle class people are. So I think there is a conversation to be had there on where do we find revenue that is actually a fair and sustainable process. But that's just me speculating. There's clearly a lot of work that we need to do. But to build the benefit, we need to know how we're funding it. And I would say that kind of brings us to the current day and where we are right now in terms of our campaign for universal LTSS. So we've done a lot. There's still a lot to do. I would say we've got a while ahead of us to get to a point of getting a bill signed. But
I think that, to add to that, Christina, while we're not sure if legislation should move forward in the next cycle, I think that there is a lot of work to be done still. And I think while CADA, while the Master Plan for Aging, and some other great things that have come of aging and disability communities working together collaboratively, I think there's more to be done on that front. I think that we definitely need to hold the state accountable to disability data. I was really excited in the governor's proposed budget in January to see a state agency on data being something that he was recommending at first. Unfortunately, it got pulled out in the May revise, but we do need a department that's dedicated to data. And I was hopeful because I think it would be getting the disability community started off on the right foot to create some really amazing opportunities to collect data that we actually want to see in our community, both all sides of disability instead of just the poverty side of disability. But as I say that, I think there's more work to be done to get us grounded together. And for the disability community, I know that there's still some divide over how far and how close we should be in creating disability and aging collaborations, or if there were ever a time in the state of California to create something similar to what has been done on a federal level, the California Administration on Community Living, bringing disability and aging under one department. I think that there's some real opportunity and some real dialogue that should continue to occur until a bill is brought forward. I know I've spoken to Nazarian, and Liz is still on the phone, but disability, as much as we are talked about in especially the budget cycle, isn't it quite amazing that we still don't have our own committee? We still don't have our own subcommittee. I first approached Nazarian when he became chair of aging and long-term care and said, I really think there would be benefits in changing this committee to be disability and aging long-term care, or making it disability and aging long-term services and supports. Disability doesn't have its own place, and I think we've come to a time where that needs to be done. I know that's something that our membership at CFILC cares about, and I think that politically we're in the right time to make that happen. But I also think that it shows how far we've come and how far we still need to move, because I learned quite a bit from my aging colleagues in the master plan process and prior to that. And we work very closely with the California Association for Area Agencies on Aging, and I work closely with some of you as my aging partners on the call. But I think that disability and aging together, creating aging and disability resource connections, the establishment of the aging and disability resource, or aging and disability resource connection center advisory committee, ADRC advisory committee, it's a mouthful. All these things that we've done, we've taken steps to bring aging and disability closer together. But I really think that there's more to be done on that front. And I also hear the voices of my peers in the disability community saying, Christina, don't let disability get swallowed up by aging. And that's not at all what we're trying to do whatsoever. And if I ever thought we were headed in that direction, I would back out. I really think that we're creating meaningful relationships and understanding each other at a level that we've never seen or experienced before, to understand why we need to create no wrong door systems and work together.
Yeah, that's great. I feel like that's a really good segue for us to.
And I see a lot of questions and comments coming in.
Right. I want to answer one thing. Connie Arnold said, why are we going to Wisconsin and why Milliman? Because Rand has done it. You can't use an analysis done in another state in California. It has to be a California specific actuarial analysis. I don't know why the Rand Corporation wasn't chosen. I actually wasn't involved. That was the Department of Healthcare Services. They may have gone with Milliman simply because Milliman has done these before. And I suspect there's probably not a lot of actuarial firms that could take something of this magnitude on. And non-family caregivers. Yes, well, I think actually I want to address the caregiving piece. Mm-hmm. The other part, the other side of the coin is the caregiving side, right? Which is people need services, but there's got to be people who's providing the service. All the money in the world, if no one's going to be available to be hired to provide the service, is another problem we have to face, right? So it almost goes back to me to the cultural shift and the cultural change, which is valuing caregiving as an actual productive value with tremendous economic value to our economy. And right now we've got this chicken and egg problem, which is, wages are super low because people are paying out of pocket and they don't have money. So they don't have a lot to pay, probably what they wish they could pay. wages are low in the IHSS side because we collectively bargain with counties at the county board of supervisor level. You probably know there are some counties with way more enlightened supervisors than other counties. I could tell you on behalf of the counties that we represent, there's a lot of supervisors that don't believe in IHSS, that don't believe that people should be paid to care for family members or non-family members for that matter. So you've got wages that are largely only at the minimum wage level. And I'll tell you one, one of the shocking facts. If you were to raise wages in IHSS simply by a quarter an hour, you're talking hundreds of millions of dollars. So there's no easy, well, you just need to raise wages. There's no easy answer on how you do that because either people are private on the private pay side, don't have the money to pay the wages, and the state and the counties and the federal funding, and it is not going to just pay a $20, $25, $30. It's not going to do that, even though lawmakers may want to. There is also economic reality that you're talking about billions of dollars collectively for these costs. So the other side of the coin, when it comes to, at least from our perspective as the union representing some of the caregivers, is how do we put money in people's pockets so that they can pay better wages? How do we not have families depleting assets and being forced to hire, off of Craigslist, the bare minimum that they can afford and hope that they get quality care out of it? How do we create an actual system where there is money to be spent that then can actually go toward what the actual wage should be? And I'll be honest with you, creating universal long-term care is not going to in and of itself solve that problem, but it's a step forward. I could spend a whole other hour just talking about how you raise wages for caregivers. And I think what Connie raised is actually super significant. If you don't have family members, if you are a person with a significant disability who doesn't have family members to do that work, you are in a precarious and terrible place. And that is a big problem, a huge problem. And frankly, talking to the board of supervisors in your county and advocating on them agreeing to increase wages for IHSS providers is one of the most important things you could be doing, at least for right now, to get there.
Yeah. And I just want to say that while I had been on IHSS when it was called something very different in my early years, my daughter was on IHSS when she was with us, and we would have been broke. We would have had to sell our home or make significant financial changes. We could not afford Olivia's care out of pocket. And again, being put in positions where we have to be very creative and sometimes lie in order to make ends meet and get the hours that are needed. It's frustrating. Why do we have to do that in order to get our needs met? We shouldn't have to do that. And I think that many of us are brought up thinking that we have it the best that we could have it in the United States because this is the United States. But let me just say, I had the pleasure of going to Spain to speak about independent living last year. And I was floored and just shocked at how well Spain has put together their IHSS system. They have a degree. You get your undergraduate in personal care services, and the lowest amount of money that you get paid to start in that field is 30 grand. Like, that's amazing that they are starting with that, and they have a whole curriculum for someone to get a degree in that. And I thought maybe Spain was the one country, in the world that's doing this, and come to find out there's several. The United States is very behind when it comes to personal assistance services. We have some big reform to do here. And I think that we also don't do a very good job. And while it doesn't work for everybody, we don't do a good job of creating marketing opportunities to talk about ways people can keep their IHSS and go to work or have other opportunities. When I was first meeting with Christina and CADA was being formed, I remember us having lunch and talking about the 250 working disabled program and how people can keep their IHSS and their Medicaid up to a certain dollar amount. Yes, while it doesn't work for everybody, the fact is most people that are on the system and want to go to work don't even know that the program exists in California. And we're only one of 6 states that has it. ABLE accounts, yes, I see Connie's remarks about the ABLE account. For me, as a working person with a disability, I see an ABLE account as an opportunity to set aside the funding that I might need living on that cliff to where I can have up to $100,000 in that account and not have to worry about it. If I do have to go down to Medicaid, I can have that $100,000 there, and it's not going to count against the $2,000 that you can't have more than in order to qualify for Medicaid. So, I mean, you have to know how to work it, and you have to know what's available. And we also need to work to extend all the programs that we have and work towards even more programs and more reform, because we are not doing it the best in the world. There's a lot of different programs and plans that we can learn from across the universe.
It looks like
So-
Maria asking.
Yeah, I think our time is up.
Yeah, I
We'll
hate
just,
to butt
we'll
in
just
because
talk all day long, Maria. So
it's a wonderful conversation, and I'll be honest, I'm supposed to be kind of bouncing around from session to session, and I've just been stuck in here because I think this is just such an open and candid conversation. It's been really, really pleasurable to sit in here. But I do have to cut it off and just let folks know that we're going to take a 30-minute break. Our second set of breakout sessions will start at 12:15. And so make sure you stretch, grab a bite, make sure you use the restroom if you need to, and then we'll back at 12:15. Jump on that agenda tab in the virtual platform and you can see what's available and join any session you want. And with that, just a lot of appreciation for the Christina Caucus. I've learned so much. I hope everybody else has a lot of great takeaways. Definitely have a lot of sound bites. So we'll be sharing those on social media. And again, thank you, everybody.
Thank you, everyone.
thank
Bye,
you,
Maria.
everyone, for joining us.
Bye-bye.